Traumatic events such as exposure to a natural disaster such as an earthquake, the death of a loved one, exposure to or witnessing violence, contracting a serious illness, financial bankruptcy, gambling habit, or sexual assault can cause post-traumatic stress disorder. Post-traumatic stress disorder is a serious health problem that needs attention. According to the evidence from various studies in large human populations, post-traumatic stress disorder is a syndrome that can be associated with heart disease. People witness or are directly exposed to sad events in one way or another throughout their lives. Many sad events such as natural disasters, epidemics, wars, violence, or sexual harassment can negatively affect people's mental health. According to studies, 1 in 5 people who are exposed to such events may develop post-traumatic stress disorder. Overall, about 8% of people develop post-traumatic stress disorder at some point in their lives. This can make people more vulnerable to mental health issues, among other health issues. One of these health problems is cardiovascular diseases. According to findings from extensive field studies, post-traumatic stress disorder is linked to cardiovascular disease. However, since some harmful habits such as alcohol and cigarette use and drug addiction are very common in individuals with post-traumatic stress disorder, this condition itself can cause cardiovascular diseases. On the other hand, since lifestyle errors such as sedentary life, obesity, diabetes, and unhealthy diet are high in individuals with post-traumatic stress disorder, cardiovascular diseases are common in these individuals. Post-traumatic stress disorder can affect people of all ages who have experienced any trauma, but women are more likely than men to suffer from post-traumatic stress disorder. Genetic and hormonal differences make women more susceptible than men. There are some theories that explain why post-traumatic stress disorder makes people more prone to heart attacks and other vascular diseases. It activates the part of the brain that is responsible for processing negative emotions such as intense stress, anxiety, and fear for a specific reason. When this acute state of stress is associated with an infection, it causes a number of substances into the blood that help the body's immune system fight off the factors that cause the infection. For example, the rate of release of white blood cells produced by the bone marrow, whose main task is to defend the body against infectious agents, can be greatly increased in such acute stress situations. Repetitive and chronic intense stress can increase white blood cell secretion, which may remain above the long-awaited level. This leads to chronic inflammation, a process that promotes occlusion of the heart vessels. In stressful situations, the body releases hormones that increase heart rate and blood pressure. In people with post-traumatic stress disorder, this hormonal balance is disrupted and the resulting hormonal imbalance tends to become chronic. Also, there are 2 common symptoms of post-traumatic stress disorder. These are serious sleep problems and social isolation. It is known that both sleep problems and social isolation increase the risk of cardiovascular diseases. A recent study involving more than 850,000 trauma histories examined how genes, lifestyle, and trauma affect health. It is thought that this study will shed light on the link between post-traumatic stress disorder and heart disease. One of the common mistakes is to use drugs unconsciously, acting on the sensations from friends or family circles. According to the sensations coming from the environment, unconsciously taking and using drugs will not help you get rid of post-traumatic stress disorder, but may also lead to completely different health problems. However, some lifestyle changes and beneficial activities can help people suffering from this problem more than medications. For example, writing is one of the most effective ways to combat trauma. Research shows that writing about the traumatic event can help reduce post-traumatic stress disorder symptoms. In fact, combining writing with other therapies can help shorten your treatment time. Moreover, you do not just have to write down the traumatic event you experienced. Writing about your life as a whole, including traumatic events, can help reduce your symptoms. An older study shows that writing can help lower blood pressure, improve symptoms of anxiety and depression, and improve behavior problems in children with post-traumatic stress disorder. It should be remembered that the effects of trauma are real and can negatively affect your quality of life even years after the event. Post-traumatic stress disorder can show symptoms in different ways. These symptoms can be seen in varying degrees of severity. It may occur in the form of introversion, which can be considered mild in some, and in the form of complete isolation from social life and inability to adapt to social life in others. In severe cases, the symptoms can be bothersome. According to experts, some people may not notice the symptoms of post-traumatic stress disorder. For example, many older individuals who have experienced trauma at some point in their lives may suffer from post-traumatic stress disorder syndrome and may not even be aware of it. In addition, some studies have shown that neglecting post-traumatic stress disorder treatment increases the risk of dementia. People may have a delayed reaction to a traumatic experience in the past. They may not show any symptoms for a long time, sometimes even years after the trauma. However, somehow being reminded of the event or experiencing a similar event can exacerbate all the symptoms at once. There are different types of psychotherapy for the treatment of post-traumatic stress disorder that can help you feel better. But you should also help yourself and cooperate with your doctor. You should also never go into a swamp like alcohol or drug addiction. Unfortunately, this is the main mistake many people make. Alcohol and drugs do not solve any problem and cause many new problems. Such bad habits do not alleviate or cure the existing problem. They only cause different problems and increase the severity of the disease. You can overcome this process in time by trying to overcome it in a healthy way. Many activities such as changing the environment you live in, exercising, writing, reading, keeping a diary, learning a new language can work to forget the trauma and heal the wounds.